Sorry, just really briefly, I am
Sorry.
going to record this
Yeah,
meeting. I know you all just got the little notification, but just so you all know.
Caitlin, you want to go ahead?
Hi, everybody. My name is Caitlin Comet. I'm a program coordinator with the Hub, and I lead the Catchment Area Council, or the CAC initiatives with us. I'm going to go with Ellen.
Hi, everyone. Ellen Brzezowski from Kids in Crisis. You'll hear a little bit more about Kids in Crisis later today. So how about Melissa?
Good morning. Melissa McGarry, Project Director of TPOD, Trumbull's Prevention Partnership. We're the local drug-free communities grant-funded coalition in Trumbull, and I also serve on the Here to Help Postvention coalition in Trumbull. How about Elise?
Hi, Elise. I know you just joined us. We're just going around really briefly and introducing ourselves, the work that we do, and kind of the organization we're affiliated with. All right, so I think there might be some difficulties, so I'll just have, oh, I'm sorry, can you go now?
There you go. Sorry, my microphone wasn't working.
No worries. So we're just going around briefly introducing ourselves, the agency that we work with, some of the work that we do, just so we can hopefully get to know each other a little bit better. So Elise, did you just want to briefly introduce yourself?
Sorry, I didn't realize you were talking to me because the audio hadn't kicked in yet.
No worries.
It's Kirsten Nauman. I'm the program coordinator for TPOD, Trumbull's Prevention Partnership.
All right. And then I don't know who hasn't gone. I don't think Allie has gone yet. So Allie, if you just want to go and then pick somebody else to introduce yourself really quick.
Yeah, sure. Hi, everyone. Sorry for the camera being off. I'm sick, so I'm like really working from home today, and it is not a look. My name is Allie Kernan, and I am a peer support specialist with Positive Directions, and I'm here to step in for well, myself and Margaret Watt, the director of prevention. And I don't know who didn't go. I'm not good at this, so whoever didn't go.
Good afternoon, everyone. My name is May Cater. I'm the Network of Care Manager for the Southwest region from Beacon Health Options, and we're also part of a partnership from SAMHSA called Connecting to Care. So I'd also be happy to share some information later if we have time, or I can just put everything in the chat. But I'll pass it to Brittany.
Hi, I'm Brittany Dubé. I handle health education and emergency preparedness for the city of Stamford, the health department. And so we've been doing work around suicide postvention, as well as I've recently became a QPR trainer. Jillian, I don't think you've gone yet.
Hi, everybody.
I think you muted yourself.
Now I know. I'm muted. I unmuted. Hi, happy Friday, everybody. Gillian Anderson, founder of My Friend Abby. We are a youth and young adult suicide prevention organization. We give out grants, small grants, to youth and young adults who are willing to take action in the arena of mental health, mental wellness, and suicide prevention. I don't know who else has not gone.
I can go next.
Giovanna.
Hi, everyone. So glad to see all of your beautiful faces. I apologize for my video being off. I'm having some issues with my camera today for some god awful reason, who knows. But I am Giovanna Mozo, director of the Hub. As Victoria said, we are the RBHAO for Region 1. And I'll pass it on to Kristen.
Good afternoon, everyone. And sorry I'm late jumping on. I'm having some issues with some email being delivered in my inbox. I'm Kristen McCarthy-Vahey. I'm state representative representing Fairfield and Bridgeport beginning in January, part of Bridgeport and part of Fairfield. I also have been newly named as co-chair of the state's Public Health Committee. I'm thrilled about the opportunity to serve in that role, and we'll be probably connecting with some of you in different ways around that. And also am a founding member of Fairfield Cares Community Coalition, as well as a social worker and QPR trainer, although it's been a while since I've done one. And it's great to be with you all. I'm going to be on and off a little bit, but thank you for having me.
Thank you so much. And I think Elise, if you can, if you want to introduce yourself, if not, feel free to put your name and everything else in the chat.
Sorry about that. My name is Officer Elise Ackerman. I'm with the Wilton Police Department, and I'm the school resource officer.
All right, so I think that's everybody. If I missed somebody, please let me know. It's not at all intentional. So I am just going to briefly pull up our agenda just so we can get started. And thank you all for being here. I really appreciate it. All righty. Okay, so I know we all kind of briefly went around and introduced ourselves. Again, if you have yet to put your name and affiliation into the chat, please do so. That's more so just for attendance. I know we already, like I said, introduced ourselves, but that's just so we all know who was in attendance here today. So we have some updates. I'll talk about kind of the hub updates towards the end of today's meeting. And then I also have just some kind of targeted updates for organizations within our region that I thought we could discuss. So I think we'll kind of just go through the state and regional updates to begin. So the Connecticut Suicide Advisory Board, just some updates in terms of that. So this month's Connecticut Suicide Advisory Board meeting for December actually took place yesterday. And there was a brief presentation by in partnership with Operation Lifesaver Incorporated, as well as Jeanette Baker with United Way. And they presented on addressing lethal means through partnerships for suicide awareness. So it was really just a presentation talking about reducing access to means that can potentially be used to cause injury or death. That's largely being done right now through a collaboration with the Connecticut DOT and a project surrounding signage. So that's really signage at train stations, at bridges that we've seen, unfortunately, suicide attempts and completions taken place as well. So again, in partnership with DOT, it really opened that door for other conversations, and this work is continuing to be done. Currently, the signs that are up throughout the state, including within our region, do have the older 10-digit suicide lifeline number. But one of the kind of ongoing and longer term projects is to update these signs. So they also include, or instead include the 988, the newer suicide and crisis lifeline that we hopefully all know about. And again, it was also discussed that in our state of Connecticut, there has actually not been a bridge suicide since 2019, which really just shows, hopefully, or reflects the effectiveness of these signs, that people are utilizing the resources. Kind of these messages of hope and inspiration are hopefully resonating with individuals. So that's kind of the Connecticut Suicide Advisory Board update. I'll talk a little bit again towards the end about 988. There have been a lot of updates with 988. I have some information surrounding call times, the number of calls, which I'll discuss very briefly towards the end of today's meeting. But that's really the largest kind of update with the Connecticut Suicide Advisory Board. In terms of the American Foundation for Suicide Prevention, AFSP, I don't know if anybody is on the call from AFSP, but I do know that in October, we had our regional AFSP Out of the Darkness walk. I was actually able to meet a few of you in person at that, so that was lovely. It's still so weird that I haven't met some of you in person. It's all just virtual, so that was a really great opportunity. But I think overall that walk, which took place in Westport at the Jessup Green, was a really great event. There were lots of people throughout the region from all of our 14 towns. And again, really just an opportunity for the community to come together, really share messages of hope, of inspiration, and really just kind of a collaboration in the community event. Again, really just to spread awareness, but also really share messages of hope. Give me 1 second. So next I have my friend Abby. Gillian, I saw you on the call, so if you don't mind just giving a brief update, and I can also stop sharing so we can all see each other as well.
Thank you. I was on the Connecticut Suicide Advisory Board meeting yesterday. I hadn't been on in a few months, so some of those of you that were on, I'll kind of just repeat what we're doing. Again, for anybody that doesn't know who we are a small not-for-profit grassroots organization located in Trumbull, Connecticut, 2.5 years old, and we got our 501c3, and 2 months later COVID hit. So just like everybody else, we kind of pivoted, but our really big focus is focusing on youth starting around the age 8, 9, 10, and encouraging them to be open and talk about mental health, mental wellness, and suicide prevention by giving out grants. We give out small grants up to $600, and we're always so pleased with the applications that we get. We have a grant committee. We also have an advisory committee that is headed up by Dr. Jessica Hoffman, who's with the Yale Center for Emotional Intelligence. So we've got a pretty good system, and we are finding that more teachers are applying for grants to do projects with their kids. School projects, which when I first started the organization, I swore I would never work directly with schools. No offense to anybody, that's just me. Just kind of knowing what the niche is. There's so many fabulous organizations out there that are doing good work. So anyway, we have wonderful partnerships too with the local EMS and Trumbull's Prevention Partnership, TPOD, and just been very, very busy as a small organization. We had our largest fundraiser of the year just a few weeks ago at Two Roads Brewery. It was called Share Your Light, and just like any other fundraising event, we had a silent auction and guest speakers. Just to give you a couple of quick examples, our most recent grants, we had a young girl, 15 years old, who received a grant in Springfield, Mass, and she did an amazing kind of event called Power of Pets and Mental Health. And what she did was a ton of gift baskets and handed them out to anybody that was newly adopting a pet at this wonderful shelter. So she had a whole write-up that went into the basket about how taking care of an animal is good for your mental health. And all of her friends helped her put all these things together. And again, we just think that starting young and opening up about mental health and suicide prevention is so important. We had a couple of young adults at the Bicultural Hebrew Academy in Stamford, Connecticut, get a grant, and they were able to bring in a guest speaker, a TEDx speaker, to their school. Again, a very progressive school, and they were very open and welcoming, and very willing to obviously talk about mental health and suicide prevention. Very intense, in-depth discussion, with professionals around. So hopefully that gives everybody an idea of kind of who we are and what we do. And again, I just thank everybody that I have been working with in the last couple of years. Again, we're a small organization, but we really love what we do. So thank you.
Thank you so much. And I think sometimes those smaller organizations like you're referring to sometimes have the biggest impact, especially within our region and our community. So I know we're really, really lucky to have you and all the work that you guys are doing. So thank you all.
Thank you.
Next on the agenda, I have the Norwalk grant. Kelly, I don't mean to kind of put you on the spot, but if you don't mind just talking a little bit about that, the work that you're doing, the work that you kind of hope to do in the near and long-term future, that would be great.
Yeah, so just a quick background on the grant. Connecticut Department of Public Health had approached us to see if we were interested in taking part in the Connecticut Comprehensive Suicide Prevention Grant to really take a public health approach at suicide prevention. And this was based on our unfortunate suicide rates from 2015 to 2019. And so as we patiently await our funding for this grant, we've kind of started to do the work of convening partners around Norwalk to start to get together, start the discussion around suicide prevention activities, as well as intervention and postvention. with our first kind of task being to really inventory what services, programs, and policies we have currently in Norwalk, and how can we work together to identify what's working well, some areas of improvement or gaps that we're seeing, and how can we kind of attack this grant head on when we have the funding to start the work. With the ultimate goal of being able to convene partners and coordinate our efforts to really work on the vulnerable populations here in Norwalk.
Awesome, thank you so much. Next, we just kind of have an open spot just for any other stakeholders or any other people on the call who have any announcements, any updates. You can kind of feel free to share those at this point. And if you have throughout the meeting, if you have anything that you want to share in the chat, whether that's just information or resources, always feel free to do that as well. Oh, sorry, Kelly, I didn't realize you had a hand up. Sorry.
Yep, just another update just to throw out. So the Norwalk Health Department has been working with Trumbull and Fairfield Health Departments to organize a upcoming region-wide mental health series with the first one scheduled for January 26th. We are trying to confirm the rest of our speakers, but this first one will be both in person. It'll be a hybrid version in person and via Zoom to talk about where to turn for help. So it's for the general public, and we'll just kind of talk about in a broader sense, an overview of mental health services, the stigma that people may find with asking for help, statistics, and then, like I said, just resources and where people can go for help. And so, again, the goal of that series is to kick off at the end of January. And I hope, Victoria, I'll share the flyer with you once I have everything confirmed, but just wanted to get it on everybody's radar.
Thank you. Yes, as soon as we get that, we will be sure to send it out to everybody. So hopefully anybody interested can attend and also share it further. I see, Michael, you have your hand up.
I mentioned that we do mobile crisis intervention services for kids and adolescents. I want to let you know that we're going to be going 24/7, and that's across the state as of January 1st. So if you can promote that as often as you can, it goes along, I think, with some of the other updates you're going to be giving about emergency services in the state. So 24/7 as of January 1st, dial 411. Thank you.
Wonderful. Thank you so much for sharing. And like I said, with Kelly's update, we will also be sure to kind of send that out to all of our contacts as well. Kristen?
Thank you. And I apologize for being off video. First of all, thanks to Norwalk for doing that regional work. And I look forward to the flyer. So I'd put my hand up and put it down because of that. And then I do want to also say thank you, Michael, for that information. And the question I would have is, I know most of the people on here are professionals, but in the simplest way possible, how would you, Michael, share that? Because, people often have that confusion of, well, when do I dial, 911 versus 211? Like what's the one-liner or two-liner that you use to help people understand how to differentiate?
It's, I think, a very difficult, I don't think it's a clear-cut answer, Kristen. We see kids who are self-injurious. We see kids who are have suicidal ideation, homicidal ideation, as well as behavioral and emotional acting out. I think if it's almost a question of how imminent the risk is, and if it's serious, and I guess you're going to rely on people's judgment, and don't hesitate to call 911. And I don't know a better way to respond to that, Kristen.
And that's a very fair answer. I think, right. So when in doubt, you can call 911, but just know if you have this option of dialing 211 and receiving mobile crisis care 24/7 starting in January.
Yeah, our goal is to minimize the number of kids who are being sent unnecessarily to emergency rooms. As you all know, there's a huge glut of children in emergency rooms. Our goal is to get them treatment in the community if at all possible, to stabilize and then to get them treatment and avoid at all costs emergency room visits if at all possible.
And just to kind of expand very briefly as well, one thing that we also talk about in our QPR trainings when we talk about ever being in a situation where 911 is deemed the appropriate route, just to kind of ask if you do call 911 for a CIT or crisis intervention trained officer, just to go that route. Those are just individuals with additional training in responding to these types of calls. So I'm sure most of you are aware, but just in case that you are not, that is always an option and a resource that is available. Caitlin?
Thanks, Victoria. Is it okay now if I talk a little bit about CACs? I'm not sure if you had that later on.
No,
okay.
Feel free to, yeah, you're good.
Okay, great. If anyone's not familiar with the Catchment Area Council or the CACs, this is an open community group for all individuals of all different backgrounds to come together throughout the whole region to share resources and raise awareness, identify trends, gaps, and needs, and really advocate to improve the behavioral health care system. And each year we get involved with the legislative session and we host a legislative forum. We hope to do that next month. And the legislative forum, as many of us are familiar, is when we invite legislators and state reps to come to just listen to what we have to say, what topics we want to talk about, and we identify legislative priorities based on our CAC members' feedback, those who get involved in our legislative work group, as well as what we identify in our priority report. This is a regional needs assessment that we publish every 2 years. We're in the process of doing our next one. And then also our Connecticut Prevention Network, or CPN, which is the 5 RBHAOs. We are the RBHAO for Southwestern Connecticut, and we've identified a few legislative priorities already when it comes to the state and the RBHAOs, one of those being mental health and suicide. And then for the smaller group or our regional priorities or our CAC, we'll have some more specific legislative priorities to talk about. So if anyone's interested in joining the CAC meetings, which is every other month, Victoria can send out that information. If you're interested in just joining to bring your perspective or to hear about resources that are a little bit more broad when it comes to behavioral health, you're welcome to join us. And then 2, the legislative work group is going to be meeting soon, very soon, so that we can start planning our legislative forum. So if you're interested in joining that, you can email me so that if you want to come and have a conversation and let us know what you're hearing, what you're experiencing in your work. It would be great just hearing everybody's backgrounds here. We can benefit from hearing your voice, and then we can connect with legislators so that they can hear our voices and also be able to report that information to the state. Last legislative forum was very successful, and thank you, Kristen, for being there and for being such a huge advocate for our work. We appreciate that. So I'll put my email in the chat. If anyone has any questions or is interested in joining, you can reach out to me. Thanks, Victoria.
Thank you so much, Caitlin. And just a little plug for Caitlin. I know we're probably all very close to capacity, if not at capacity, but if you have the ability to really be involved in the CAC in any way, I really encourage you to do so. They're really great meetings, and I know just since I've been on board, the CAC has done a lot of great work and had really tangible results, especially in relation to the legislative stuff that Caitlin was just discussing. So I really do encourage you all to really take advantage of that and to be able to use that time to, like Caitlin was saying, really voice your experiences, your opinions, because those voices are amplified within these meetings. So thank you for that. Does anybody else have any updates before we kind of continue on? There will be kind of some additional time at the end in case anybody thinks of anything, has any additional questions, or wants to share anything else, but now is the time to do so. There will be time at the end as well. So now I'm going to hand it over to Ellen. I know on our agenda, I did have a point to discuss postvention. I will be discussing that more in terms of the hub. But if nobody else has anything to share at the moment, I will hand it over to Ellen.
Thanks, Caitlin. Victoria, sorry. I'm looking at Caitlin. So Victoria, if you don't mind, could you share your screen? That something is funny with my computer today. So I just think it'll be easier if you don't mind. Many of you on this meeting today know about Kids in Crisis, but I'll just go through some of our programs and what we're seeing within some of the programs that we run in terms of the mental health issues that the children we work with are facing. So if you have questions, you can stop me during the program. I can answer them afterwards, whatever works. Can you get it up, Victoria, or do you want me to try to? Oh, you're on mute.
Sorry, no, I have it. It's just not letting me minimize. So give me 1 second. I'm pulling it up, but I couldn't. I had it on my desktop, but give me 1 second. Sorry about that.
No problem. No problem. See, I'm glad somebody else has trouble with this stuff.
Oh, almost always. I'm very easy to depend on that with that kind of stuff.
Yeah. Okay. Thank you.
Yeah, of course. And then
yeah.
just let me know whenever you want me to advance a slide.
Yeah, you could just go to the second one. That this is just our logo, so that's fine. Okay, so Kids in Crisis has been around for next year, 2023 will be 45 years that we will be celebrating. And it really started with these two services. And so it was our helpline and our shelter service, emergency shelter program. So those were two separate services, and then they merged together to become Kids in Crisis about 45 years ago. So we are located physically in Greenwich, Connecticut, in Coscob. That's where the emergency shelter is, and our crisis counselors work out of, but we have a lot of different community services as well, which I'll talk about. But we have a 24/7 crisis hotline. It's staffed by trained counselors who are available, any time of the day or night that kids can call it, parents can call it, teachers, community workers, anybody who is feeling like there might be a child at risk or that they need help dealing with a child. And many times we get calls on that helpline for not only to get kids into our emergency shelter program, but also just to have somebody to talk to or get more referrals or get some ideas about how to help a child who's struggling or a family who's in crisis and needs some further assistance. So many times the calls lead to an intake into our shelter program, but that's not the only reason that helpline exists. We did recently get a grant, and we are hoping to start a text line in the next year or so. Because we also know that most of the time teens would rather text than actually pick up the phone and talk to somebody. So that's in the works. So our emergency shelter program has 10 beds when we are at full capacity, and it provides respite for families who may be struggling with a child who they're really having trouble with, or the child is having trouble with the family, or there is a parent who maybe is in a substance use treatment program in the hospital and needs a place for that child to be during their treatment stay. There could be many reasons why a child comes into the shelter. Usually the shelter program ranges from about 2 to 4 weeks stay, but we've had children who've stayed less, and we've had children who've stayed much more than that. The goal is always to reunite children with their guardians, parents, if that's possible. Most of the time that happens because we have staff. We have two social workers on staff, and then youth workers as well. And one of the major things we do is family counseling during the child's stay. So we're working with the family to try to work out whatever the issue is, and then put services in to help support that child when they go back to the home, whether it's a different home or the same home that they were in before. We had children here this summer who came from a pretty chaotic background and needed glasses and never had eyeglasses. And we were able to get them glasses during their stay. So it's just things like that, that hopefully when there's a more stable environment, when there's some separation, if there's some chaos in the home, that those kinds of things can be helped and brought to the families and the youth. And then hopefully other services can be put in place so that there's more stability in the home when the child goes back. We do have a medical clinic on staff. There is an APRN there who can help with prescriptions if that's needed. We also, and that's through family centers that health center is operated by. We also have a consulting psychiatrist and psychologist who see every resident who comes into Safe Haven, and they do some testing to just help them, and also can work with their outside providers if they have any, to help with medication maintenance if the child is on medication, or help advocate for them to start on medication if that's required or needed. And then lots of recreational activities. They're taken to the movies or to the mall or to parks when it's nice out. And so we really try to have a balance between the therapeutic services and the recreational service, and really try to make it a stable environment for everybody. I'm sorry, the slide cut off, but we did just recently get a federal grant for 10 more beds on our campus in a separate facility for unaccompanied children. And that's called our cottage program. So that will start sometime, hopefully after the new year. You can go to the next slide. So Teen Talk is a program, one of our community programs. Many of you are probably familiar with it, but these are masters of mental health counselors who are in some of the middle schools and high schools within Fairfield County. So they are employed by Kids in Crisis, but physically sit in the different schools. So they are an adjunct to the mental health staff that's already in the school. They're really there for kids who wouldn't otherwise get mental health services in the school. So the social workers, psychologists who are in the school are really mostly dealing with children who have special education designation, IEP, 504. And there's a whole bunch of other kids that don't have that designation, but still have a lot of mental health needs. So that's generally who the Teen Talk counselors are seeing. It is a voluntary service. Nobody's mandated to come see the Teen Talk counselor, but we do a lot with the school staff, administrators, other counselors, social workers, families, parents, and students, word of mouth. And that's how we get a lot of our referrals. So I just listed the 15 middle schools and high schools that we are in. We have just hired somebody newly. I see Kim Zemo on the call, and we are so happy to say we are going to be back in Wilton High School, and it will be full-time. That used to be a part-time position, but the need is there. And so we just hired somebody for that position. So we're really excited about that. Many times parents and students alike will come to the Teen Talk counselor because there is a level of confidentiality there, because we are not school employees. Not to say that we don't work very closely with the school staff, we do, but they do feel like maybe there's a separation, and like we don't write in the school records, that kind of thing. So there's sometimes a level of comfort there. But I will talk a little bit more about what services they offer and the risk assessments that the Teen Talk counselors do. And unfortunately, the numbers are high for those things. So I will get to that a little later in the presentation. Safe Talk is a program that's been around for a long time. It's trained staff and volunteers present like an anti-bullying and age-appropriate assault prevention program to children, students in grades K through 5 in their classrooms. So we're invited in by the different schools. Many times it's been elementary schools in Greenwich and Stamford. We've been in Darien. I think we've been in Norwalk in the past. Because of COVID, things have changed and shifted, but we are trying to get into some of those schools again. The motto is safe, strong, and free. They do a lot of role plays with the students, and it's a great program. So that's another community-based program that Kids in Crisis provides. Okay, next one. We are a designated safe place. We're the coordinator. So basically what that means, Safe Place is a national program, and businesses and community sites can designate or get designated as a safe place. For example, a firehouse could be a safe place. So that means that a youth could walk in and say, I'm in danger, I need help, or I just don't feel safe. And so what that community organization would do was call Kids in Crisis, and one of our trained crisis counselors could go out to whatever organization that is, try to assess, provide services, see if that youth would be appropriate for our shelter services, or try to help hook them up with other resources in the community to make sure they're safe. And then the Juvenile Review Board, a lot of communities have JRBs. We work very closely with the one in Greenwich and provide the case management services for those. So I say here tweens and teens, but we're also in the elementary schools, unbelievably. So this is a restorative justice program. It's for youth who have maybe some sort of minor offense with law enforcement, and it's a first offense. So before they get sent to court, they get this option of, working with the police and a case manager from Kids in Crisis, and it's through our Youth Service Bureau. And they work on a contract and then usually meet with a case manager once a week. Could be anywhere from 2 months to 3 to 4, 6 months to complete that contract. Usually there's a component of community service around that. A lot of times the contract involves getting that young adult or youth into treatment for mental health reasons or substance use treatment. So we work with a lot of community partners around that. So it's a little unique in Greenwich because we provide that case management service for the JRB. A lot of communities don't have that case management piece in their JRB, and we do find it helps with the success rate, and children usually complete that program pretty successfully. So next one, Kate. So the interagency team, it's called IAT, is something that Greenwich also came up with for youth who may have not gotten to the level of committing a crime, but staff at schools may see that the child is headed kind of in a risky direction. So we came up with this IAT team that will help students in the Greenwich Public Schools, K through 12. It requires buy-in from family and students, and there is a commitment, but it doesn't have that extra piece of, if you don't finish your contract, then you're going to be sent to court. So this is before there's a sort of interaction with law enforcement, but it's still for children who are identified at risk and could use that extra case management piece. So we have crisis counselors working with them usually on a weekly basis for a standard period of time to help get some services in place before they get to that JRB point. The Lighthouse is a program for LGBTQ positive or plus youth. They are allies. It provides teens with unique opportunities to have a support group, a safe space to socialize, share their stories, just have a space where they feel comfortable to be themselves and not judged. They can be children from homes where the parents know and are welcoming and supportive of them and their status, or it can be children who are not out yet to their parents or others in the community and just kind of questioning and figuring out that process and need a safe place to talk about that. So the longest running Lighthouse program is in Stamford, and it really is well attended. It has been around for 10 years or so. And we have recently started one in Westport at the teen center there. And then we are also starting one in Greenwich. It used to be at a church. Now I think it's going to go to the Boys and Girls Club. So those are two newer groups that we're trying to get youth to participate in. We know that there's a need in every community, and we're going to try to continue to create these groups in each community. We may begin a remote session option for children who are, outside those Greenwich, Stamford, Westport areas and would still like to have that support. It's not the best option, but right now for kids who may not have transportation to these other groups, it might be an option that would be helpful to them. The the coordinator of the Lighthouse program recently changed. We had a man who was wonderful for many years. He started the program in Stanford. He unfortunately had some medical issues this past year, so had to drop off, but we've hired a new young coordinator who is incredibly passionate about this whole program and would be very willing to talk to youth even one-on-one if they're even just considering attending or if they need some help and some resources. So that is something that we can provide as well. Okay, next. So our Kid Talk program is an extension of Teen Talk. And right now we have a Kid Talk counselor at the Boys and Girls Club of Greenwich. And so they are in their after-school program providing mental health counseling. They educate and help train staff members in dealing with children who may have challenges. And they work closely with the elementary schools and middle schools in town in Greenwich and the families of the children that they're working with. It's an incredibly busy program. And we just received a new grant to start a pilot program of Kid Talk at a Title I elementary school in Greenwich. We're going to be at Hamilton Avenue School in Greenwich, starting hopefully in January if we can. So we're hiring for that. So if you know of anybody who's master's level counselor and likes to work with young children, please send them our way. But great program. We're hoping to pilot this in other boys and girls clubs, in other elementary schools. The need is there. We've seen the mental health issues, unfortunately, in the younger ages. So people are really asking for this program. So, okay, next. So Greenwich Together is, even though it's not a specific program of Kids in Crisis, it's administered by Kids in Crisis. So we are the fiduciary for this local prevention council. So this is the prevention council for Greenwich. So it's a coalition of more than 30 Greenwich agencies, government, education, health, law enforcement, and with the common goal to prevent substance misuse and promote mental health and making healthy choices. So that's just another one of our community initiatives that we participate in. We also are members of the Greenwich Postvention Response Team. We have some staff at our organization who are trained in both QPR and mental health first aid, youth mental health first aid. So we definitely want to be part of those suicide gatekeeper trainings and be supportive of those where, however we can be. And the one trainer we have for QPR is also Spanish speaking. So just so you know that in terms of that need as well. Okay, next. So this is just a flyer I included. And so Caitlin has this PowerPoint so she can send this out to everybody. The reason I like this flyer is because it has a QR code on it. And so we know a lot of people won't actually take a piece of paper anymore or brochure, but they can use their phone to just scan the QR code. And then the helpline is right there and they can just enter it right in their phone. So again, that's the 24/7, 365-day helpline that anybody can call, parent, community member, child, staff member, anybody, to just get help. And even if they're questioning, if they need help or questioning what resources are available, they can use this. So, so that is there for anybody who needs it. Okay, so next. All right, so these are just some stats. And all of these statistics that I'm going to give you when you see the fiscal year 22, we chose a 5-month period from 21 and now for 22, just to show you, trying to compare apples to apples a little bit. So our helpline calls during that 5-month period last year were 212, and this year we're already up to 273. They're up 28%. We got 71 calls on that helpline, both in October and November, which is our busiest month since May of 2016 when we got 76 calls. So there's definitely a need. We want to continue to get the word out about that helpline so people know that they can use it. We also, very interestingly, are starting to receive a growing number of calls from outside of Fairfield County and outside of Connecticut. So our services in terms of the emergency shelter, Teen Talk, those kinds of things are all lower Fairfield County because we do provide transportation to the residents who are residing in the shelter. So we really can't go too far beyond Fairfield County in order to get them back and forth to school and things like that. But even if people are calling from outside the traditional catchment area, we can provide services. We look up things on the website. We have a lot of resources in our referral lists that we can give people and try to hook them up with resources in their community. So even if they are outside of our catchment area, it doesn't preclude them from calling us, and we can try to help. Okay, next. So these were our residents in Safe Haven. Again, for those 5 months in 2021, we had 27. This year we were at 28. We are normally a 10-bed shelter, but our maximum right now is 7. And that just was from the COVID pandemic. We never closed during COVID. We actually had 3 siblings that were there when COVID first started.
Yes, hi. I called a couple of days ago from the counseling center in Trouble, and someone was supposed to send me the information for volunteering. There's a high school student who wants to volunteer, and I never received that email.
Oh, there she goes. Okay. She didn't realize she was unmuted. Basically, we've stayed open, but we have had to lower our numbers just because of the pandemic. The new program, the new shelter, the cottage, will also be 10 beds, and again, hopefully up and running in January. Next one. So these IAT JRB numbers are not completely updated, but in 2021, for those 5 months, we had 11 IAT cases and 14 JRB. During this period, we have 7 IAT, but that's probably low. And we have 19 and counting JRB cases. So there was a lull a little bit when COVID happened. There really wasn't, we were doing JRB still, but it was a lot through Zoom, and they weren't taking a lot of new cases. And quite frankly, we weren't seeing as much activity because of the stay-at-home order, and there was all of that. But now we're seeing the uptick again. So, okay, next. So Safe Talk, I don't have all the updated numbers for Safe Talk because the same team that does the Safe Talk program is now in the midst of Holiday Central, which is another program that we do at Kids in Crisis, where we provide gifts for about 300 families. So they could be some of our families who either stayed in the shelter in the past, some of our Teen Talk families. There's whole different ways we get referred families. So they are in the midst of giving out all of these gifts today and tomorrow at a local church in Greenwich. So I didn't want to bother them with updating stats, but we are in about 13 to 14 elementary schools in Greenwich and Stamford doing that anti-bullying presentation. And again, trying to get into other communities back in them since COVID has hopefully slowed down a little bit. Okay, next slide. So in our lighthouse, we, in that 5-month period, saw 33 teens, and then the same 5-month period, we saw 15. And that did go down because, as I mentioned, the coordinator of Lighthouse had to take a step back, and there was a good amount of time where we didn't have a program, and we're just kind of running on volunteers and just had that Stanford group running. But now that we have a new coordinator, we do expect those numbers to go up a good amount. So, okay, next. Okay, so Teen Talk, this is where you'll see a lot of the stats. But so again, in that 5-month period last year, we had 662 individuals enrolled. And now in the same 5-month period for this beginning of this school year, we've had 715. So the numbers keep going up. The need is there, definitely. So we had 2,076 individual counseling sessions last year. And already this year, you can see it's gone up to 2,142. The top 3 presenting issues were anxiety, depression, and family conflict last year. This year, anxiety is still the number 1, and pure conflict and depression are as well. We think the pure conflict is, again, we're seeing kids getting back into school. There's not the hybrid anymore. And so the pure conflict, we're definitely seeing that because kids were out of school or inconsistently in school for those 2 years during the shutdown, that maybe they weren't interacting as much with their peers, but now that that's back in more full swing, we're seeing that conflict go up again. Okay, next. So this is sort of the year-end summary for last year. So we saw a total of 1,160 students that received one-on-one counseling across all the schools and the Boys and Girls Club that we are in. 291 received the group counseling. And more than 3,000 individuals, whether it was students, parents, teachers, were reached by presentations. So Teen Talk counselors also can do presentations either at their schools, inside their schools. Sometimes they work with the local prevention councils or the different community organizations that deal with mental health and substance misuse, and they provide presentations in that way as well. So this one, I think, is the one that is pretty unfortunate, but it shows the need. We had 132 risk assessments provided last year. So that is, trying to assess for, as students express suicidal ideation, do they need to be taken to the ER for further assessment? Do we need to call 211? Do we need to, have an ambulance come just to the school and see them? So we had 39 students who their primary presenting problem was suicidal ideation, but of those other 1,000 students who came in, as the counselors talked to them, they realized that they were also experiencing some sort of suicidal ideation, self-harm. So we ended up doing a lot more risk assessments because in the course of talking to the students that we found that there was a need to assess risk and make sure they were safe. So, and that's probably one of the highest numbers we've seen in the history of the Teen Talk counselor position being there. So unfortunate, but all right, I think that's it. These are just slides that talk about our vision, where all children are happy and safe. That's what we hope. The next one. Our mission is building healthy communities where children and families thrive through prevention, counseling, and crisis services available 24 hours every day. Next one. And these are our core operating values: being inclusive, being responsive, acting quickly and thoughtfully, and being collaborative. We work with many of you in the communities, and we can't do this alone. So next one, and that's it. So those are our services. I know I went through it pretty quickly, but any questions you have about any of the services we offer, any of the stats that I went through, anything else that you'd like to know about?
Ellen, it's Kim. It was interesting to see your stats for October and November, because we saw something similar in the school with kids having mental health crisis, this large uptick in the 2 months.
Yeah.
So
yeah.
it's nice to know it's not just located to one area, I guess.
No,
Good, but
unfortunately, it's all over. I know. It's all across Fairfield County, and I'm sure, we know that it's all across the United States. So it's unfortunate, but we're happy that we can provide the extra service to the schools. We'd love to be in more schools. It's a matter of funding, as it always is. But we try to work with the school community so they can try to provide a piece of the funding. We can try to find foundation grants and other supports. But ultimately, we rely on Board of Ed and school budgets to help fund this program, along with our development team who tries to find funding as well.
Ellen, I first of all want to connect with you offline about the Spanish QPR. So
Sure.
hopefully we can provide that to our community, but also just wanted to express, we're so grateful to have Kids in Crisis as a partner in Stamford. They've helped us with postvention, with our Youth Mental Health Alliance. So just wanted to amplify the good work that you're all doing.
Thanks, Brittany. We're happy to work with you guys too. Your postvention team, you've been hit so hard in the last couple months, and they really rally around the people in the community who are experiencing those tragic losses. So we're happy to be a part in it.
Ellen, it's Michael Patoda. Very impressive. I had no idea the array of services that you offered. Could you talk a little bit more about the new program for unaccompanied minors?
Sure. So it's a federal program. So all of the referrals will come from the federal government. So it's a little different from our other program where people will call in to the helpline to make their own referrals. We will get all the referrals from the feds, and then work with the children who come to us to then reunite them with family that's here in the United States. And so we'll provide, they will have school on site until they are able to be transferred or reunited with their families. And so they'll get medical care as well, and and any basic needs that they need while they're staying with us. And then part of our work will be to help find the families that they are looking for to get reunited with. So it's a big task. We've hired some staff already. We're still looking for more youth workers, but we do have a teacher on board. We have a clinician. And everybody has to be Spanish speaking because that will be the majority of the population. And we've heard also that most of that population will be more toward the tween teens rather than the younger children, but we don't know for sure yet. So.
Thank you. So needed.
Yes, very needed. Yeah.
Thank you so much. And really just to echo what Brittany was just saying, we're so lucky to have you guys in the region and the amazing work that you're doing. I do have a question, and I don't know there's probably one really answer that you can give, but is there any kind of underlying, I don't know if cause would be the right word, but just anecdotally through the work that you're doing that you can kind of circle back or kind of point to in terms of these increasing numbers? I know it's kind of difficult because everybody's, mental health experience is so vastly different, but I don't know if there's any, kind of themes or experiences that are kind of common among the majority or some of the, clients that you see.
Yeah. I do think COVID has had an impact. I mean, we always sort of blame COVID for everything, but I it's a reality. And people were, sheltered away for a while, and there was lots of not being connected to support. And now we're sort of back in, and people are seeing each other in person. And I think there was unfortunately some pretty chaotic situations at home where kids usually can get to school and get out of those for a little while, and they weren't able to do that. So I think that's part of it. I think coping skills are tough, that kids haven't really learned the coping skills because, again, they weren't in these situations for that period of time where they could practice or use them or learn them. So I think that's a part of it. I think there's also just traditional mental health issues that underlie things. There's a biological basis for some of the mental health issues. There's family stressors, family history, substance misuse, domestic violence. So I think we're just seeing the whole gamut. And I don't know if there's a reason per se that we're seeing more of it. I don't know, Kim, if you're seeing anything.
Yeah, exactly what certainly uptick in mental health crisis, which I had a question actually, Michael, in terms of from the school's perspective. I appreciate that we're trying to keep kids out of the emergency room. What we're seeing is that kids go who are in significant distress, and then they're not admitted, or they don't go, and a safety plan comes up, is created, and it takes a while to get them into the appropriate level of care. And in the meantime, the school is trying to be the primary treatment supporter for these really high-risk kids. And we just don't have the staffing to be able to do that. We haven't seen an increase really in mental health staff to kind of match the need. We are trying to, we're hoping to get in on the recent Connecticut grant to increase social workers and psychologists, but I don't know if we'll get that. So
I can empathize with you, Kim. We're in a very similar situation in our outpatient clinic. Mm-hmm. We have kids who need a higher level of care or who are transitioning down. And there aren't that many in-home programs. No. In-home programs are having a really hard time recruiting and retaining staff. So IFP, FFT, some of those, and even partial hospitalization programs, intensive outpatient programs are having a really hard time. So what ends up happening is those kids get defaulted back to our outpatient clinic, and there's a high level of risk associated with maintaining those kids on an outpatient basis. Right? I clearly understand what you're saying.
All right.
Yeah, and we see the same thing with our teen talk counselors. They make referrals, and unfortunately there's just no beds or anyway.
Kristen,
I actually do have a question too, but I think Kristen raised her hand before I.
I'm happy to yield to you, Giovanna.
Thank you, Kristen, but go ahead. You first.
Okay, thank you. I just want to acknowledge what you all are saying, and certainly in wearing not my Fairfield Cares hat, as I say this, but my new role as the co-chair of the Public Health Committee. I would love to talk with you about how we continue what we built on last session with the Children's Mental Health Bill, which, I certainly don't view as an end. It's a continuation. And while we've been on this call, actually, the governor just announced a $32 million federal grant that the Commissioner Giuthani had worked with getting from CDC to look at infrastructure development, and particularly for provider pathways. I mean, I know that doesn't answer, Michael, what you're saying or what any of you are saying about immediate moment beds, but addressing the provider shortage and the access to care is really important. So I guess we'll see. A lot of that money, actually, I think 12 million is going to be going directly to public health departments. So we'll learn more about that in the coming days.
So, I'm just thinking, how are folks, counselors, social workers, those that are working with individuals, teens, tweens, how often are they referring to the support groups? In the meantime, before actually, waiting for a bed or waiting for a service? Because I think that a lot of times, and we hear this, right? We've heard this for the last two plus years, more so, but we all know that there has been a shortage in beds, has been a shortage in services, or at least there's a long wait. So on the hub end, what we try to do is encourage folks that we have a support group guide, right? And we're able to compile all of those free support groups in the meantime, while this person or family is waiting for services. Because if they're not in a complete crisis, right? Typically, crisis, you're going to the hospital, right? But beforehand, trying to help and support that person is what we want to do. So I'm just thinking support group lists, what are we offering in our region? Looking at that, I see Ali's on, she now has the Alternatives to Suicide support group. So is that something that we should be doing more so now than ever, is to send them that way, or at least training our clinicians to look at that support group list? I don't know what people's thoughts are.
Yeah, I mean, I think that the support groups are great. Unfortunately, I think some of the teens that we're seeing are such high acuity that it's a little scary, just to say, well, while you're waiting for inpatient, go to this support group, So we're really trying to hook them up at least with one-on-one, or, but not to say that that couldn't be, another avenue. Absolutely. The one that Ali though facilitates, that's for 18 and over. Is that correct?
Yeah, that's right. Unfortunately, we can't take younger just because then there's like liability issues and whatnot. But technically, it's not like we card at the door. Someone could easily come in and say, I'm Joe Schmo, and
there goes that loophole.
20, so
right.
I will put that disclaimer, because there is that disclaimer there, and I'm not gonna turn someone away or anything. So yeah, that's what I would say about that. We just had somebody come to the group that we got referred from the Norwalk Police Department, and they were attempting to take their life by a high-rise building, and thankfully they got connected to our group, and they've been going ever since. And we've been seeing pretty good data out of our group so far, even just running since October. So definitely send people my way.
Yeah, absolutely. That's great.
Gillian, I see your hand.
Yeah, I don't really have a question. I have more of a comment. As a parent who has had a child that died by suicide. I just want to validate your work. You guys are doing amazing, amazing things. I get calls every day. I mean, I know I talk about happy little grants and stuff like that we give out, but I get crisis calls every day, and I always have to say I'm not a crisis organization. So young adults, parents, everything. So again, just thank you all for the work that you're doing. And I know it's really, really hard. And I was going to kind of say the same thing. I talked to a mom the other day who literally left her daughter for 10 minutes. She knew she was already kind of struggling, and within 10 minutes they had to call 911, and she's being discharged, tomorrow. And this person should probably be inpatient for about a year. So, and I know you guys hear these stories every day. So again, just validating the work that you're doing, and thank you so much. And I hope we find some more answers soon in terms of getting the system, a little bit more in place. So thank you.
Thank you so much. Are there any additional questions? And Ellen, if you don't mind, if I just share your email in the minutes, just in case anything comes up afterwards, if people have questions, comments, just want to connect offline with Ellen, if you don't mind.
That's fine. That's absolutely, I can put it in the chat for you. Yeah.
Okay, great. I'll also be sure to include it in the minutes, but that will be great as well. And thank you, Ellen, again, just to kind of echo what everybody's saying. I think, our region's only 14 towns, but I think we all are vastly aware of how much amazing work I think everybody on the call is doing, and then, outside of that as well. So again, just thank you all for that. Next on the agenda, we have kind of more of the hub updates, kind of side of things. So the first thing that I wanted to talk about is postvention. So over the summer, everybody, all kind of employees of the hub, so to speak, have been trained in postvention TOT training. So we are now able to kind of disseminate that training out to the region. So we actually worked specifically with Darien. We postvention trained a smaller kind of cohort of individuals that are on their mental health task force. But we're also hoping to really offer the postvention training to our region, kind of more open to the region as well. And that will be in the new year. So I'll probably end up sending out more of a doodle poll style just to gather people's thoughts about when would work best. But really the hope with this is that, we're getting 1 to 2 people from each of our 14 towns in the region to really just come, have these conversations about postvention. I know some of our towns are, a little bit more advanced in their postvention plans, their postvention teams. So also having that be a space of kind of collaboration and, within our communities, especially, towns that are closer together, really being able to connect, especially, we always see, contagion with suicide, but, in the day and age we're living in, even if a loss by suicide occurs in one town, there are often ripple effects in neighboring towns or other areas. So just having that kind of collaboration as well. But Ellen, I see your hand.
Sorry, you made me think of when you mentioned Darien. So even if we don't have Teen Talk counselors in a particular town, and I think about Darien and their unfortunate events that happen in the spring, school systems and places call kids in crisis, and we can send our Teen Talk counselors to help support. So we were in Darien High School for a couple of days seeing kids. There was something that just happened in Norwalk, and we helped there as well. We do have Teen Talk counselors in Norwalk, but we can send others extras for support. We've done it in Wilton in the past. So even if we're not in a particular school system, you could still reach out to us and we could help. And a lot of the Teen Talk counselors are very willing to go into different schools to help during a crisis time. So I forgot to mention that.
No worries. Thank you for sharing that. It's definitely really helpful to be aware of and to know as an additional resource that you guys can offer. But in terms of postvention, that is really just what I'm thinking. So please expect probably more so in the new year, but for, more likely myself, but to reach out to you all as kind of the RSAB, individuals who attend our meetings just for your thoughts in terms of dates and scheduling. in terms of that as well. And one other thing, I have a very brief kind of 988 presentation that I'm going to run through, but are there any questions before I do so? And always, again, like I've mentioned, feel free to put questions, comments in the chat, but give me 1 second and I will pull up this other presentation.
I just wanted to add, in case it's helpful, Ellen mentioned that we've been using our postvention team a ton here. Unfortunately, we added untimely death in addition to suicide to our postvention plan because a lot of the response is very similar. And so that's the reason why we've been quite active, unfortunately. But I will say, I do think it really helps our response. So I'm happy to talk to anybody about that, adding the untimely death side of it to the postvention plan. I don't know, Ellen, what your experience is, but I think it's really helped with our community response to some unfortunate incidents we've had recently.
Yeah, I think the resources are incredible that you guys have shared in Stanford. And I think, well, I know for Greenwich, we've also done that. We've shifted to untimely death because many times too, we're seeing the opioid overdose, and it's hard to know sometimes whether it's intentional or unintentional, but it's still, you know, I think all of these untimely deaths are still an opportunity to provide support and resources to those in the community. And it's just a more structured way to do it than to have all these different agencies, you know, trying to reach out. It's a much more coordinated response. And I think it really benefits the families and the friends and people who need it. So.
Thank you so much. And another thing that I know we've talked about in the past, but I am also more than happy to kind of offer, you know, a shorter, maybe 1 hour meeting here and there, more so focused on postvention, inviting you all as more postvention leads, people who are involved in postvention teams. If that is at all something that, you know, people are interested in, think that they could benefit from, I'm more than willing to do that. I think, like I mentioned before, I think there are some towns that are really established in their postvention teams, and I'm always more than, you know, happy to learn from you all and what works and what doesn't. So again, if that's at all something that is of interest, or people think that they could benefit from, please let me know, and I can definitely work to kind of coordinate an additional, probably shorter meeting, but just to come together and do that as well. All right, so I'm also, like I mentioned, just briefly going to be talking about 988. This is a presentation that I received from Andrea with Demas. So it is, I will be fully honest, this is not my presentation. So it is an abbreviated version, but it's just about 988. There is some data that I did want to really highlight and focus on. But I know all of you on this call are familiar and knowledgeable about 988. Being the new suicide and crisis lifeline, really working to, you know, transition from that 10-digit number over to 988. So the first couple slides are more so data, and my apologies if you guys are already familiar with this. But again, this is findings from the school health survey in 2019. So 70% of students reported that their mental health was not good. Students felt sad or 30% of students felt sad or hopeless almost every day for 2 weeks or more. And only 1 out of 4 of these students got the help they needed when they felt this way. So I think, you know, here at the Hub, we include a lot of this data within our QPR trainings. And very similar to what, you know, Ellen was talking about when she was presenting on, you know, the data for kids in crisis. I think, you know, unfortunately, these numbers and these statistics are definitely certainly sobering and definitely, you know, upsetting. But I think it's really important as well to be aware of these numbers because ultimately, I think it really informs and empowers, you know, all of the work that we're also doing. So again, just some more findings from this, a little bit more specific to suicidal behavior. 1 in 8 students who participated in this survey in 2019 seriously considered attempting suicide in the year prior or during the past 12 months, and 1 in 15 had actually attempted suicide during those past 12 months. And then again, this is more so mental health data or statistics specific to adults in the state of Connecticut. So 1 in 8 reported poor mental health for 14 days or more in the past 30 days, so about half of those days. And then depression. So 1 in 6 of those individuals, those adults were or had been diagnosed with depression. So again, this is more so data specific for 2021. This is across the state of Connecticut, so these numbers are not specific to our region. So again, Southwestern Connecticut, I do have the data more specific to our region if that's something that you are just wanting to look at, include in your own kind of presentations, that is available, and I'll be more than happy to share out that information as well. But I think, again, it's just really important to be mindful, cognizant of, this data, and especially as this slide kind of reiterates or highlights. And again, my apologies if this is redundant, if you guys are already aware of this, but we are seeing an uptick in the number of, suicide ideations, suicide attempts, and suicide completions in our elderly, so to speak, age groups. So again, ages 65 and up. So definitely just something to be a little bit more aware of. One presentation I'm really hoping to bring to the region in the new year is surrounding, more individuals who have dementia and suicide. It is something that in our statewide presentation, it was discussed. It was something that for me was really eye-opening. I definitely did not, recognize that correlation between the two. So again, that's something I'm hoping to bring to the region in the new year. So just be on the lookout for that as well. So this kind of goes back to a little bit more of what we were talking about towards the beginning of the meeting, but really just kind of the difference in 911 and 211 and 988, and really being able to differentiate when each number is really applicable based on the situation. So again, this is more so just information on 911 in Connecticut. Last year in 2021, there were 2 million 911 calls. So again, just really important to, again, just be mindful of these information. And similarly, the 988 linkage system to crisis services. So again, this is just kind of follows the kind of line of 988, how that kind of goes about. And really the work and the alignment of services that is the goal of 988. So a little bit more about 211 988 action line. So they really all filter to the same center. So regardless of which number you call, you will be connected to services which are 24/7, so 24 hours, 7 days a week, every day of the year. And again, this slide is really just outlining what is available, what is accessible through these numbers. So again, mental health screening, suicide risk assessments, follow-up contacts, and again, if it's needed, a warm transfer to additional services, should that be deemed as being necessary. But this is the most kind of important thing that I wanted to highlight, that I thought was really kind of beneficial for us all to know, be aware of. But it's just 988 kind of data and statistics since it has been kind of rolled out. So we have the total number of Lifeline calls received, Lifeline calls answered. I know in other meetings that I have attended, there has been significant discussion surrounding the speed of calls being answered. I think there has been a little bit of confusion surrounding this as well. But I do just want to highlight that, especially in more recent months, as 988 has really been, those kinks have been worked through. The seconds to answer that call, you can see in July, August, September, and October, it has been 4 seconds. So thankfully and really amazingly, these calls are answered really quickly. Hopefully people are being, connected to services, connected to resources, connected to that individual that can hopefully de-escalate that situation really, really quickly. So, I think, again, this is really important data to be mindful of. I can also, share this in the minutes. I will check with Andrea if I can share the entire presentation, but at the very least, I will be sure to share out these statistics. I think, I think there's been a lot of great work surrounding 988, but like anything that's kind of newer, there still are some confusion, some questions. So hopefully this data can can offer a little bit more concrete answers for those who might need it. Brittany, you have a question?
Yeah, just a clarifying question. So if people dial 211, does this data include that or only people who are dialing 988 at this point?
So this also includes 211.
Okay, thank you.
Yeah. So again, youth mobile crisis intervention is 211, option 1 once, and then option 1 again. So again, this is for children, so ages 18 and younger. And really, again, very similarly, that mental health screening, suicide risk assessments, suicide risk screenings, and it also offers short-term follow-up care and really just a collaborative effort to really connect people to resources, to additional treatment should they need. Very similarly, adult mobile crisis, again, is 211, option 1, and then option 2. 211, regardless of whether it's adult or youth, again, is 24/7, 365 days a year. And it's very, very similarly for adult and youth. It's just more, specific services based on that age range or age population. So like I already mentioned, like we already briefly discussed, when is 911 really the best kind of course of action? So obviously, I think, this probably goes without saying, but if someone is in immediate risk or is in need of immediate medical attention, 911 is always the best option to go. Like we mentioned, always asking for that CIT or crisis intervention trained officer. Mobile crisis can also respond to a situation with police assistance or after police have stabilized a situation. So calling the police does not exclude a mobile crisis response. So they are not mutually exclusive in any capacity. And then again, when to call 211 or 988. So again, calling mobile crisis or 211, if you're kind of considering sending someone to the emergency room, and you are in need of a mental health evaluation or that risk assessment. Or similarly, if you cannot reach a person during a suspected crisis. You can also call mobile crisis even after you've called 911, and they can again respond to the situation in collaboration with the police. Or again, like I mentioned, after police have kind of stabilized that situation. So this is more so what you can do to help in terms of schools. I don't know how many people are really affiliated with the schools on this call, but again, very similarly, I think some of this is more so common knowledge, but always just, supporting suicide prevention and response planning within schools. I know a lot of us on this call are either QPR trained or QPR trainers ourselves. So, always really encouraging individuals to partake in those trainings, to just be mindful of, mental health best practices, suicide prevention best practices, as well as postvention, best practices as well, because postvention can quickly become prevention in and of itself. And then again, more specific to providers about what you can do. So again, always promoting, mobile crisis 211, 988, and doing so in a way that is, really easily digestible for people. So, the biggest kind of takeaway that I'm sure you all have heard already is that there really is no wrong door. So really just pushing that message out as well, that regardless of whether someone calls 211, 988, they are going to be, or very similarly, that old 10-digit number, they will be connected to, resources, to somebody who can help. Again, there is really no wrong door. And then again, just ensuring that clients and caregivers know how to get help, where to get help for themselves, for others who might need it. And then again, just promoting evidence-based strategies, evidence-based practices. Again, and that goes for prevention as well as postvention, intervention. All of those are really, really closely intertwined. Like I was just talking about, just reiterating messages of there being no wrong door in Connecticut. People, again, will always be connected to somebody who can help, to a crisis contact center. Again, there are always, more specific call lines, text lines, for youth versus adults. You know, as we all are hopefully much more familiar with, Kids in Crisis is also a resource, you know, for ages 18 and under that can always be utilized. And the hub has a lot of flyers and information, again, on some of those more specific call lines, text lines, crisis lines. You know, there are more, you know, law enforcement call lines, domestic violence hotlines. So, you know, in any capacity, in any situation, just being aware of what is available to refer people to as well. And then again, this is just more resources surrounding 988. SAMHSA has a whole 988 toolkit. They have some 988 fact sheets as well. So I know I always reference back to those. I send those out to people if I ever have, you know, questions. There's a 988 frequently asked questions, and I'm sure these will be updated as, you know, 988 is, you know, around for longer. And again, those kinks are worked out. But some really great information just to always refer back to, or just refresh yourself, disseminate if needed. And yeah, that ends the brief 988. Like I said, I will share that data in terms of the 988 calls. But are there any questions about that specifically? All right, so that was kind of the end of the hub updates. Is there anything else? I know I also briefly mentioned QPR trainings when I was just talking. The hub, you know, continues to offer our QPR trainings open to the general public on the first and third Tuesday mornings of every month. Positive Directions also has a standing evening training. I believe it's 6 to 7:30. I will have to double check on that as well. But if you're ever, you know, hosting QPR trainings and need support or assistance from the hub, or very similarly help promoting that, you know, we're always more than willing to do so. But yeah, are there any other questions, comments, concerns? Yeah, Kristen?
Thank you so much, Victoria, for this meeting and for all the work that you all are doing. It's really wonderful. I will just note that some folks from the Trevor Project had reached out to myself and to Rep. Curry about doing some work legislatively on changing some of the language related to our LGBTQ community. And I have encouraged the Connecticut Suicide Advisory Board, the advocacy group, to, you know, I know are going to work together with AFSP, I think, to look at a legislative agenda specifically related to suicide prevention. So I would just encourage folks, if you have specific thoughts related to suicide prevention. I know things are so connected, obviously access to care and so many other things. And Norwalk, I'm excited to see, Kelly, what's going to happen in your community and elsewhere. But I did want to put that out specifically to the LGBTQ community piece, and anything else. And please, if you don't have my cell phone number, you know, as you're doing your work, and if there are things in the legislature, I'll put it in the chat, but please always feel free to reach out.
Thank you so much. And I'm sure I speak for all, if not most of us, that if there's anything that we can do again to support that, you know, we're definitely more than willing to assist and help in whatever capacity that we can. Is there anything else? All right, so I will be sure to compile these minutes. The recording for this meeting, as well as all other hub recorded meetings, it's always going to be on our YouTube in case anybody wants to refer back. But like I said, I will be sending out the minutes. And one last thing before I let you all go, the hub is working on compiling and working on our priority report, or our regional needs assessment. Part of that is we will be holding focus groups. And that's really just an opportunity for you all to kind of vocalize what you're seeing in terms of behavioral health, suicide prevention, substance misuse, mental health. So we really always want you guys to be involved in this process. You know, we learn as much from you as hopefully you learn from us. So again, we will be having, you know, ongoing focus groups in the next couple of weeks and months. So You will probably see another email from me asking you all if you are willing to participate in that. So just be on the lookout. I would love to see you all again, at least virtually. But with that being said, I will give you some time back on your Friday. And again, expect the minutes from me in the next week.
Victoria, what's the date of the next meeting, of this meeting?
So it is in March. I don't know the day
Okay.
off the top of my head, but that will also be in the minutes as well.
Thank you.
Yeah, of course. Thank you all.
Thank you. Happy holidays, everybody.
You as well.
Michael, it's on the 10th.
Have a
Thank
great
you,
day.
Giovanna.
Thank
Bye-bye.
you.
Okay. How'd you do?
I think it went well. Okay.
Kids in Crisis is, oof, my God, they're
They do
doing
a
so
lot.
much.
I'm always so impressed. They do so much.
I like 45 years. That's
I know,
as long
that
as I've
long.
been living. Longer, 5 years longer than I've been living. Like, whoa, that's crazy, and that's good.
Yeah.
Yeah. Okay. Sounds good.
All right.
Enjoy the rest of your afternoon, and I'll talk to you soon.
Sounds good. Thank you.
Okay, bye.